Okay.
Yes, sir, you can start. Sir, please share your screen, sir.
Yeah. Okay, so hi everyone and welcome to this session. This is our mock paper discussion session. I am Dr. Ankit, your anatomy faculty at our Auricle platform. And today we are doing something a bit different and useful to all of us, to all of you mainly. We are going to show you a mock paper. And in that paper, we are going to discuss what are the things that we should write, we should avoid, what diagrams we should make, and all that. So it's going to be interactive question answer session. Get your questions answered. So today there's a mock paper discussion. I'll show you the paper, and I'm Dr. Ankit. Let's see some highlights of the Oracle. Oracle, we all must be knowing about its features like live classes, recorded classes, notes, and you have MCQs. You can also use the code below. This code over here is Dr. Ankit 20 for some discounts on our very subscription. Various plans also over here. Again, this code will help you in getting some discounts. Here we have basic course of 3 months for 15K, then standard course for 6 months for 30K. And finally, we have a whole 1 year course mentorship program having a specialized mentor as well, and for 50K for 1 whole year, right? So these are the various plans of Oracle. And let's start the mock paper discussion. And particularly, we'll start with this. I'll show you the paper first of all. Let's just see what are the various important questions that the team has had the paper on, and then we'll proceed further on, right? So, guys, this is the mock paper of anatomy. Okay. So, this whole paper is divided into few questions or type of questions to be more precise. We have two long questions, which are known as the essay questions over here, right? They're of 10 marks each. So, these are two long questions. One question is from the topic of upper limb, the shoulder joint, and one question is from the brain, that is the meninges of the brain and the circulation of CSF, right? Then apart from this essay, we have around eight short questions, each having 5 marks. And these are the 8 questions. You can see the topics. We'll discuss one by one. And though this paper is of 3 to 3.5 hours in totality, but within a span of an hour, we'll try to see and we'll try to cover up the important these points in each topic. Then we have around 10 brief questions over here, right? These are 10 brief questions. And finally, as we all know that we have this 10, in the end, we have the 10 MCQs as well, having these 4 options and single best possible answer over here. This is the format of the question paper, right? So let's start with the essay questions. So we have 2 questions over here with the 10 marks each. So once you know that it is of 10 marks, and nowadays it's good that they give the subtopics in the question. Okay, that these are the topics which the examiner or person who is checking the paper, he is mainly or she is mainly looking for these points in the answer sheet, right? So you should be crystal clear that, okay, I have to describe the shoulder joint, but under the headings of articulating bones, be precise. Then I have to tell about the capsules and ligaments. I have to tell about the movements with as many muscles involved in those movements. I have to tell the nerve supply of the joint per se. Okay, what nerves are passing across the joint. So there's supply joint, the relations of the joint as well as the applied aspect. So this is the first question, right? So let us try to see what all we can write over here. So what we have bones, capsule, ligaments, movements, nerve supply, relations, and applied. Okay. So let us see over here. If we have this question over here, then how we are going to proceed? And we should remember, first of all, that this question is carrying how much marks? This question is carrying our 10 marks, right? So you have a 10 marks question, or the topic, you have the shoulder joint. Topic, we have the shoulder joint over. Okay. Do remember, you have to make as many diagrams as possible, but the key to solve any paper, not just this paper, is you have to have some basic time management over here. So that you have suppose 3 hours, and how many 3 hours and how many marks? We have total 100 marks. Okay. So suppose you have read a shoulder joint very well and you are devoting half an hour for just one question for 10 marks. That doesn't make any sense. When you have 3 hours for 100 marks, it means that your goal should be what? Your goal should be what? I'm telling you personally what I used to do, and luckily there was never a day when I missed paper. But when you have 3 hours for 100 marks, be sure that for the first hour, at least I should touch around 40 marks of paper. It could be 35, 38, 40 is the max. I should aim for that. In the next 1 hour also, again, I should touch around, say, again, 35 to 40 marks max. This is first hour, I should touch questions of 40 marks max. Second hour also, I should touch a 40 hours max. Then for the last hour, I know that technically I would be left with only 20 marks of paper. Suppose that jumps out to be even 30 marks, even that is fine. It is under my control, right? So this should be our aim. So it you know that the first hour, if I have a goal of 40 marks, and if the shoulder joint question, this carry 10 marks, right? This carries how many marks? 10 marks. So how many minutes? You should give 1/4 of the hour, that is 15 minutes to this question. If you want to expand it, don't go more than 18 or 20 minutes. That is fine. That is the rule over here. That is the rule over here, right? So first of all, time management is very crucial. Else I have seen every year tens of students who are like, sir, my paper was left, I knew the answer, but I don't know how I could not write that, and my few MCQs are left, my few these questions were left. So that is something which is easily avoidable, and we all should avoid it, right? So first question, shoulders on 10 marks, give 15 to 18 minutes to the max. In that it is of 10 marks, though. What are the points which the examiner has asked? They have asked about the articulating bones, right? Be clear. They have asked the examiner, when the examiner mindset is clear, they're asking about the capsule. They're asking about the muscles. They're asking about the movements, right? They're asking about the applied aspect. They're asking about the nerve supply. They're asking about the relations. They're asking about the applied aspect. They're asking in the end about the applied aspect as well, right? So see, they have divided the question into 3, 4, 5, 6, 7, around 7 to 8 sub parts of the question. And total marks of question is 10 marks of the question. Then you already know that each sub part is carrying at least 1 or 2 marks. So be precise. You don't have to beat around the bush here and there. You have to be precise. Okay, that 1 mark should be carrying out the bones. How I will start the question? Shoulder joint, big heading. Then I can easily start with the bones participating in the shoulder joint is the head of humerus and the glenoid cavity of the scapula, right? That is the theory aspect. So you know, okay, this is clear. Then come to the second point. So you have to write, say, a big right over here, the shoulder joint, answer number one, and to start with like this, and then the bones participating in it. Then you can even change the color of the pen if you want. Suppose this is black or blue, so change the color to say light blue, whatever. You can answer over here that okay, these are the bones. Okay. Then you come to the second topic. What are the capsules and the ligaments involved? So things should be clear. It is good for you to fetch marks also. One, bones you have written, then you have written about the capsules and ligaments. So for the person who is checking the paper, just imagine, guys, if you tomorrow are checking the paper of any subject, how easy it would be if the student has written in this format, right? Simply, it will be easy for you to give marks also. Capsule ligaments, again, 3, 4 lines over here. Then you can easily make diagrams. Now, diagrams now. The thing over here is most students, they have that mental block. Okay, sir, I can't make diagrams. I'm not good in. No one is checking the beautification of diagram. You simply have to make, okay, the head of the humerus over here. You make a glenoid cavity and a bit of a scapula, basic anatomy over here, and a coracoid process coming in, and you have this accruing process coming. Simple as that. So examiner is over there is looking that you know the basic knowledge of the topic you have or not. There, no one is looking for the beautification of the diagram. Basic idea should be there. So if you have any mental block that okay, I can't make diagrams, forget about it. What you can do for that, you can practice the diagrams during the preparation time. You can practice in your rough notebook. Simple as that. There's no other shortcut. You can practice the diagrams to label it. More important than beautification is how to label. You have to label this is the head of humerus. You can make a cartilage over here. There's a glenoid cavity. You can say coracoid, acromion, middle bottom scapula, and 1 or 2 more labelings. That's it. Okay, I hope you got the point. So then you have to write capsule ligament. So each subtopic, muscles, movements, nerve supply, relations applied. So, don't forget, don't leave any subtopic Okay, unanswered. Even if you have very less knowledge, even answer them in 2, 3 lines. Diagrams you can make in capsule, you can make diagram on over here. You can make a diagram for capsule also. For muscles, you can actually make diagram, one diagram for movements of muscles. Then relations, very important. You need a diagram. Even if you're not writing much in relation, the diagram should be there. And obviously applied aspect, what the applied aspect, you know that shoulder dislocation is there. There's rotator cuff injury is there. There is frozen shoulder is there. So many injuries of shoulder. This is how you can answer this first question, just example over. Now, let me show you some slides. This is the some slides of shoulder joint I'm showing. And if you attended our lectures in Oracle, if you go to the lectures which we have covered 1 month back, okay, shoulder joint we have covered, other topics also we are covering on a daily basis, then you can see the actual notes. The actual notes of Oracle are beautifully placed. They are in question answer format. You have fun zones, you have MCQs, everything is over there. So I would really advise that if you are confused, any one of you is confused on so which notes to study, I can understand the books. I know that for the first year, the books are not the books, the manner in which the books are written, it is not very student friendly. Uh, Things are a bit complicated, can happen over there. So Oracle notes I have seen. I have taught also a few classes from Auricle notes. They are beautiful, right? So you can take a look at that. If at least in the this videos you can see, else you can even order the notes over here. So this is the general diagram. Now you don't have to label everything. You have to show over here the capsule and the ligaments per se. So only focus on what the examiner has asked. Sometimes students, they, you know, if you know the shoulder joint in detail, in a very you have studied in detail, so don't go with the flow. Okay, for 35 minutes, you are writing only shoulder joint. No one is going to give you 20 marks out of 10. That is obviously, you know, also, right? So be precise. First of all, I told what time management. Then be precise what they have asked. Remain there only. Suppose you don't know anything about, suppose they have asked you 8 subtopics of shoulder joint. 8. Just imagine for a second, you know about 5, rest 3 you don't know anything, then you can write some related topics around it, right? But if you have if you know more than 8 topics, don't write here and there. That is simply waste of time. This is the diagram for the relations. Obviously you can't make a beautiful diagram like this. That will actually take more time, but if you can sort of make it right. So here also the figure over here is showing the relations. Should know why they're asking you this, because again shoulder joint operations are common. So over here you have to simply make a joint in the middle, right? Then try to make some muscles around it. These are the ones, obviously these will be the rotator cuff muscles. Try to make the capsule, try to make the bursa over here, and then try to make a couple of bones like acromion and coracoid over here, and a couple of more muscles. No one is good. The diagram need not to be beautiful, but proper labeling is what the examiner is looking at. Simple as that. I'm telling you from an examiner perspective, right? Because we check the copies. These are the movements over here. This is all we have covered. Abductor, adduction, because we all know the shoulder joint is which type of joint? It's a ball and socket, right? Type of synovial joint. This is how you can start with, right? You can start with the shoulder joint, just one line. The shoulder joint is a ball and socket type variety of synovial joint, okay, multi-axial movement. Okay, stability is less. Some basic points you can write in first 2 lines. It will hardly take how much time? 15 seconds. It is not that much stable. Mobility, there's too much of mobility, right? So just 2, 3 lines in the beginning that gives you a tempo, right? So this is how you can proceed with the just I discuss the topic over here, the shoulder joint. Okay, next let us see what is the next question that they are asking. Meninges of the brain, add a note on the circulation of CSF. Now you know that this question is of 10 marks. So obviously describe the meninges of the brain, add a note and a note on the circulation of CSF. Okay. So meninges and circulation of CSF. Okay, let us see over here how we can proceed this. So again, this question, it has 2 parts. This question has how many parts? It has 2 parts. One part is you have to tell about the meninges. Okay. And the second part is you have to tell about the CSF circulation. These are the 2 topics which they have asked in this particular question over here, right? CSF circulation. Simply, you should know basic common sense that both of them are carrying 5 marks each. Okay, 5 marks each. Both of them demand at least 1 to 2 diagrams. Things should be very clear. CSS circulation also 1 to 2 diagrams. One minimum. If you can make 2, fine. Again, this whole question, how much time you should devote? 15 to 18 minutes. It should be crystal clear. So see what will happen. Suppose after 2.5 hours, Last 30 minutes are left and 30 marks paper is left. That is going to be very traumatic for you. Okay, there's going to be too much of stress and anxiety will develop. And anxiety, you will do mistakes. So don't do that, right? So 15 to 18 minutes, okay. So you know this idea. Meninges, basic idea you should know. Okay, we have three meninges: dura mater, arachnoid mater, pia mater. And there are slightly anatomical differences in the skull and in the vertebral column. We have two layers of dura mater in the skull and one layer in the vertebral column. And each of them, dura, arachnoid, pia mater. Okay, at least you should write about 5 to 10 lines of for each of the meningeal layer. What is their function? Where are they located? What do they do? Arachnoid matter, pia matter. Talk about subarachnoid space. Talk about subarachnoid space. Because ultimately you have to tell about the CF circulation also. So this way you should devote the time. Diagrams are easy. You can make corner section and just show the dura, arachnoid, and pia matter. Dura, you can make obviously two layers of dura matter. You can easily write the outer endosteal layer in the skull and the inner true meningeal layer. Okay, applied aspect you can write. We have subdural hemorrhage, we have epidural hemorrhage, then arachnoid layer, subarachnoid space, we have the CSF, right? There can be subarachnoid hemorrhage, pia mater is stuck to the brain or the whole CNS. Similarly, for the vertebral column, also you can write about the spinal cord. Like there's one or two diagrams, simple as that. Out of five, you can easily fetch around 4 marks, 3.5 to 4 marks you can get. Then comes the CSF circulation. This is a very scoring CSF circulation, remember 1 to 2 diagrams, 15 to 18 minutes. Now, how much minutes for this? You have at least 7 to say 9 or 7 to 10 minutes for it. I'm telling over here, you have to keep a track of the time. Keep your wristwatch on the table. Keep a track on your time. Don't look at the wristwatch after every 15 seconds. But yeah, after every 10, 15 minutes, you should have a look at the watch. How is your speed going up? So CSF circulation, you can easily start with how the CSF is formed, right? And then how is it circulated? Fine. And finally, how is it absorbed? Simple as that. These are three things which are actually asked from this question. Though they ask only circulation, but it is common sense that you can easily answer about the formation of CSF and how it is finally absorbed or reabsorbed through the arachnoid villi. Formation, you can talk a little bit of the chorionic villi and how is it circulate. Now here the diagram will come and CSS circulation, and the thing is flow chart you can easily make. Can easily make a flow chart over here. CSF is formed, then CSF goes from lateral ventricle, you have the inferior horn and the central body part, the anterior horn, then it goes via the foramen of Monro, then goes to third ventricle. From third ventricle takes up what the aqueduct of Sylvius, goes to fourth ventricle, then you have the openings over here. From there, so it is a complete flow chart. Your whole 1 or 2 pages can be easily covered. If you have, see, once you write the whole answer, no, take at least 15 seconds to the max. Take a highlighter or a different color pen and underline the important points from that theory answer. It hardly takes you 10 seconds after you finish writing the answer, it hardly takes how much 10 seconds to take a different color or a highlighter just to highlight 5, 6 important points or subtopics you have written in the answer. So that the examiner knows that, okay, the child has a good knowledge, he's written all of this, give you good marks. Okay, so flowchart and a diagram that is sufficient for a question like this. This is how we can actually move around the question. Okay, let us now move to the another question. These are the two long questions that we have done. Okay. Now, similarly, we have development of face. Okay, we have blood supply of long bone, we have rhomboid fossa, we have cleft. Now, each question is carrying how much marks? 8 into 5 is 8 questions. So each question is carrying 5 marks. Basically, they are a type of, you can say, like meninges was carrying 5 marks, same over here. So it has equal weightage. So, okay, you got the point. It has equal weightage. So again, each question, how much time we can devote? Again, around 7, 8 minutes is sufficient. 5 to 10 minutes, one question should be done. Okay, and again, each question, needless to say, minimum one diagram is required. Again, I'm telling you, most important thing in diagram is labeling. Like, for example, let me show you a few things over here. We have face development, bone, rhomboid fossa, clavicral fascia, and radial artery and joint of thumb, collateral circulation. Enumerate the sulci and gyri of this brain over here. Okay, fine. These are the short questions. Then before you have the brief. Okay, let us see some short questions in this PPT only. In this PPT only, let us see some. Okay, so now Let us move to, okay, this is the development of phase. I'm showing the diagrams over here. You can see them in the notes also. Now see development of phase, again, you have 2, 3 diagrams over here like this, right? But ultimate diagram, let me tell you, for your exam point, you can make this diagram and finally you can make this. These 2 diagrams you can easily make. Color coding is required over here. Why? Because you all know who have studied the topic, this yellow color is your medial nasal process, and this blue is the lateral nasal process, red is maxillary, this is your mandible. Okay, these are your eyes which are going medially, and finally this picture. So you can make a diagram like this. Different colors are required. If not, at least if you don't have colors, you only have black and blue. Like I normally used to have only 2 colors. Then you can make like this, lines like this, or like this, and label it. Okay, some dots over here to make it separate. Okay, this is this, some circles over here. Okay, this is this process, this is that process. This much is then. Second thing in this question is you can make a table like this. It is carrying 5 marks, remember. You can make a table like this. Each part you can say, okay, frontonasal process giving rise to these structures. Maxillary, medial, lateral, mandibular, like this. So this is one way to answer. Then one diagram over there. See, right? And the third thing you can write is about the clinical aspect. Why are you studying this? Because of your various anomalies over here. Various anomalies over here. You can name it as unilateral cleft upper lip. It is bilateral cleft upper lip. Make any diagram. Make anyone. You have cleft lip plus cleft palate over here. Right? You have cleft palate. You have this oblique facial cleft over here. This last image over here. This is showing us what? Oblique facial cleft over here. So applied part. Out of 5 marks, let me tell you, 2 marks minimum for this applied aspect. So that is why we are studying this. Got the point? So you can make a flow chart. You can make a simple diagram over here. These are just the images to show you, and then you can make like this. They fetch you marks. Blood supply of long bone. For this question, obviously, you should know this is not. When you're writing this question, I am sure that we have covered it in general anatomy. These are the 3, 4 main arteries. You should highlight it after you are writing about it. So how to answer the question? See, in exam, question comes blood supply of long bone. Now, for those who have a good idea of this particular topic, we will start with blood supply of long bone. Long bone, these are the arteries which supply. First of all, explain each artery like epiphyseal to periosteal, nutrient artery, and all that. So theory-wise, you can write around 1.5 pages. Each artery, you can write around 4, 5 lines, right? Then the second page or third page, you can make an image, the same thing which you have written in Droid. Simple as that. Okay, then you can give your applied aspect also. Suppose there's a fracture over here, there's a dislocation over here, which is the largest nutrient artery. What does the nutrient artery give? Then you can tell the law of the nutrient artery direction is opposite to the growing end of the bone. Then you can talk of that towards the from the elbow towards the elbow I go, from the knee I flee. Okay, that milking cow position, that also you can draw over here. So yeah, if you have a good idea, you can go like this. If not, for those who have not a very good idea of the blood supply, suppose you have missed this topic, you only can remember 1 or 2 arteries, you can, in this question, be a bit smart and explain something about the long bone. That long bone has 2 ends, epiphysis is there, right? It has a diaphysis, it has metaphysis. This basic you must be knowing. Okay, the bone marrow, right? The hematopoietic cells are found from there. Okay, we have white marrow, you have yellow, you have red marrow, you have yellow marrow. The red marrow gives rise to erythropoietic cells. Like this wise, you can bit off, you can at least write a page of it. Then you can write a couple of arteries. There's a nutrient artery which goes and supplies the bone. Then here you can say that, okay, you have that hair and pin, right? For patients, so children who have that osteomyelitis, no? At the region of what? At the region of metaphysis, because this artery is there from a hairband loop over here, right? Where the cartilage is still there, you have a hairband loop over here. That is applied aspect. So depending on how, so but ultimately time, as I told you, 5 to 10 minutes only. Suppose you want, okay, in the end, I will have some time. So keep at least half a page empty so that you know I've written whatever I know. But I think that whatever I've written, it is looking a bit less. Leave half page in the end. That is why I said in each hour, do 40 marks, at least 35 to 40 marks should be the max target. So that the last hour, half an hour, you're cool. Whatever half pages you have left, you can revise your answers. Then you can write or make some diagrams. Because see what happens is, let me tell you, you guys also must have experienced that once you are looking at a paper, there's a question, then your thoughts are running, okay, what I have learned, then you start to write the answers. At that moment, whatever will come to your mind, you will write. You don't have liberty at that particular moment to wait and sit for 5 minutes to think, okay, what else I can remember. That will be wastage of time. But the moment you're answering the next question, next question, next question. As 1 or 2 hours pass, somehow it will happen that some other question will come, and that will help you in remembering the previous question. So it is always helpful to leave some pages in the beginning so that in the end, half an hour, it will happen. It will happen that some other idea will come to you. You will again recall some other point, and then you will write again. This is how you can actually score better also. So you get blood supply bone, you can answer. Then there was a question was rhomboid fossa. Just an image over here. But rhomboid fossa is, as we all know, that we have the fourth ventricle over here. This area, that is the area for the rhomboid fossa, basically the fourth ventricle over here, right? This is the area for the fourth ventricle. It looks like a diamond-shaped rhomboid fossa. Again, diagram is needed over here. Diagram is needed over here. This is, once you separate the cerebellum, you're looking at this rhomboid fossa. See, the beauty of anatomy and particularly theory is why I keep on telling them, okay, practice at least 1 or 2 diagrams on each topic. Suppose the question comes over here, like in our mock, we have given a question of rhomboid fossa, and you are not aware, okay, what to write. Then, but you know the diagram. Explain. This is what I keep on telling many students. If you don't have any idea, you have some idea of the diagram only, then simply explain the diagram in the theory part. And once you explain the diagram in the theory part, somehow time will come that, okay, keep on your common sense open so that you might recall the applied at some point. It just comes all of a sudden. If you stress it too much, no, then it will be difficult. Now you're writing, okay, this could be applied part. So here, obviously, you have the facial colliculus, you have that inferior, you have this trimedullaris, you have the cerebellar peduncles, you have this vagal triangle, you have this all those nucleuses over here. All these are important, right? And you can obviously write some applied part that, okay, do you have this foramens which can be blocked, then this will happen, hydrocephalus can happen, all that. So at least the question is of 5 marks. Examiner will look at, okay, he doesn't know much about it, but okay, 2.5 or 3 marks I can easily. So you will easily pass. This is what should be the motive, right? Because in theory, you don't expect 100 out of 100, right? Topper gets around 70, 75, max to max. In some colleges, they might get 80, 70 or 80, but a topper is around 70, 75. And the bulk of the students are around 55 to 60, 65. 55 to 65 in our time, so I'm telling you, bulk of the students lies in this particular marks range, 55 to 65 out of 100, I'm saying. Topper is 70, 70, 75, and below 50, obviously not clearing the exam, right? So rhomboid fossa, you can discuss about that. Then comes the clavipectoral fascia. Should know the basic idea. This diagram is very important for talking about the clavipectoral fascia. This diagram over here. This is where this is actually sagittal section over here. Again, clavipectoral fascia diagram for each topic, right? Yeah, this is over clavipectoral fascia. This is P measures for anterior, and yes, let me tell you, anatomy, when you are studying the anatomy, preparing for the exam, and you look at any diagram through either the Auricle notes or the books or the whatever from wherever you have studied, when looking at the diagrams, be sure which view you are looking at. Be sure which view you are looking at. Okay, so when you draw the diagram in the exam, you know that it is anterior, posterior, superior, inferior. Or somehow some students also write it like this, which is seen in books. No, this is A, P, and S and I, so that the examiner knows, okay, the student is serious about the study. He or she has serious knowledge of the topic because they know exactly. So in this diagram, you can simply make a plus and you can write anterior, posterior, superior, inferior, middle, lateral, whatever you want to write. This is very important. Then say clavipectoral fascia. In this topic, again 5 marks. So diagram 1 or 2 diagram. Then what are the structures which are piercing clavipectoral fascia? What is the applied aspect of clavipectoral fascia? Simple as that. These are the things which the examiner actually wants. What does an examiner want from a student of anatomy is you should know the anatomy and you should know what is the clinical implication of this particular topic with a diagram and simple as that, right? So which you can answer over there. These are 2 diagrams just to discuss this topic. Then there was question of collateral circulation, simple topic in general anatomy. You can make a couple of diagrams like this over here. Okay, fair enough. Okay, I guess let us see the question once again. I guess this was a question of the sulci and gyri of I guess some lobes they have asked. Let us see the paper again. Okay, so after okay, we have radial artery also. So see again over here, they're asking what in this question origin, course, relations, and applied anatomy. Actually, this is too much for 5 number question, but yes, they have asked. So imagine that origin will have 1 marks, course will have say 2 marks, Right. And relations again, 1 marks and 2 marks for applied anatomy. So this is how they can distribute it into 5 marks. Okay, so four topics is 1 for 2. So they can either write applied for 2 marks or course for 2 marks, and other topics for 1 mark. So focus over here only. What is the origin of radial artery? Simple diagram, make a brachial and divide it into radial and ulnar artery. Right? Where does it take origin? What is the course? You should know applied aspect of radial artery. What do we do of radial artery? We palpate over here in front of the radial styloid process to look for the pulsation. Normally we do this. Then you should know, okay, it goes into the anatomical snuff box. It is the main content of this. Then it forms what? It forms a deep palmar arch. This is all what they're asking you. They want that, okay, you know this or not. Can you palpate the radial artery in the forearm? In the upper part? No, because it is hidden by or it is overlaid by the muscles. These are all the things which you have to say. Applied anatomy, simple palpation. Then if you have to take a arterial blood gas analysis, ABG, you take the blood directly from the radial artery, you can take blood from there, directly from radial artery. Okay, these are the applied aspect. Anatomical snuff box, you have fractures over here, bone fractures, you have Colles fracture, Smith fracture. Write about it. Whatever things are coming to your mind. Relations, write about the relations. Okay, courses. Once you tell the course, if you have a good idea of the course, the relation will come automatically because if you know the course, you know the relation. The course is going through which relation? Then you have carpometacarpal joint of thumb. Why are they asking you this? Carpometacarpal joint. First, a CMC joint. It is a saddle variety of joint. It is a saddle variety of joint. So let us stop a bit over here. It's a very important topic. Comes also in your PG exam. So carpometacarpal joint of thumb. First CMC joint. First CMC joint. It is a saddle variety of synovial multi-axial. Simple over here. How to make diagrams, sir? Or why to worry? Make first metacarpal like this and make a carpal. Which carpal will form the CMC joint? Think you have scaphoid, lunate, triquetral, pisiform in the proximal row. And here what you have? Trapezium, trapezoid, capitate, and hamate lateral to medial. So this is which one? This is trapezium. This is T dot ZIUM. This is trapezium. This is first metacarpal. This is the joint. Then calculate is a saddle variety of synovial joint. No, but it is a 5 marks question. You have to make diagrams. You can't think, okay, it's okay. I just know saddle variety. I will write saddle, and they will give you 5 marks. Okay, that doesn't go like this. Apply common sense. You have at least, say 5 to 10 minutes to answer it. Okay, so make a diagram simple and tell the applied aspect of it. Say it is said now saddle is multi-axial. So tell the movements over what are the movements which can happen in the thumb. Thumb can have flexion, extension, adduction, abduction. So the same wise you can talk of the movements in this joint. What are the muscles involved in this joint? Okay, so devote 5 to 10 minutes at least, not for the particular question. So for CMC, remember saddle variety can answer like this. Now CMC for CMC, thumb. Tell about the thumb, how it is 90-degree different from the other fingers. What are the movements over here? This way you can answer, right? Then okay, Salkai Garai Deva, so simple. See, brain, it is very simple. You have to just have to practice to make a simple brain like this. Lateral view or medial view. Then make some sulcus over here and over here. Then you have frontal, parietal, temporal, occipital lobe. And then you can simply make area Salkai Gairai over here and then try answering over here. I guess the question, if we look back to the question was about yeah. So enumerate the sulci gyri of parietal. Now here you only have to enumerate. Okay, the examiner asking you enumerate, only enumerate. Don't try to make multiple diagrams or write 2-3 pages theory, not required. Enumerate the sulci gyri of parietal temporal lobes of the cortex. Mention the function. Now here you can make diagram also. Because functional areas, parietal temporal, you have the auditory cortex, you have the whole Wernicke's area, right? You have the postcentral, you have the sensory area in parietal lobes and all that. You can answer in functional areas, Broadman's number. Here you can make diagrams. So when they're asking you enumerate, it is 2 number and this mention the functional area, that will be around 3 number. This is how the marking is done actually, right? So this is how you can go ahead with this particular question. Then as you go down over here, you have questions like, oh, these are 10 into 3 marks. So there are 10 questions. Each is carrying how many marks? Each is carrying 3 marks. Now here, obviously in 5 marks, if you should at least devote the normal copy, if I talk about the normal copy which you get in university exams. In a 5 mark question, minimum two-sided minimum should be, minimum I'm saying, could be 3 sides also you can write. If you are making diagrams, could go to 2.5 or 3 pages. but 2 to 3 sides should be done, should be written and made a diagrams for a 5 number question. Got the point? For a 3 number question, you should aim maxes 2 sides, 1.5 to 2 sides. Once when I say side, one side is not a one whole page. One page will have 2 sides, no, front and back. Okay, about 3 number question, if you have written very well, even one side is enough. At least 1.5, a couple of applied aspect you can write. This is what you should know number wise again, how to devote. Now 30 marks, how much time you should give total for this 30 marks? At least 50 minutes. Okay, 50 minutes to 30 marks. 50 minutes meaning by 10 questions, 50 minutes, each question max to max 5 minutes. So 3 to 5 minutes should be given over. This should be clear to you. Now, when they're asking you chord equina, what will you do in this question? You will make a spinal cord. Okay, you'll show all the spine roots coming out of it, and then you have to explain chord equina. This is a very interesting question and highly scoring. If you know the concepts, you can easily answer it. So in case of chord equina, suppose the question over here is coming as they've asked over here, the chorda equina. The chorda equina, right? So what you have to do over here, simple as that. First, you can start with making diagrams, spinal cord ending, right? Then here you can show, okay, the thoracic spinal roots are coming and all. It ends when outside. This is how you can easily make. You can make some vertebrae over here, right? You can make some vertebrae over here on both the sides. And you can show, okay, this is L1 and finally this is L2 because spinal cord in adults ends at the lower border of L1. So L1, L2. So here you will show that, okay, L1 is coming out, nerves are coming out, then below this, all these are coming down and they are coming out from the respective intervertebral foramens. This is what is known as chorda equina, horse's tail. This is what they actually want you to anatomically, you should know this. Then, if you make this diagram, then explain it in 5 to 10 lines. It is 3 marks question, remember, 5 to 10 lines. Then also in the end, if you can write an applied, 2.5 marks are a minimum you will get. Chord equina syndrome, write a couple of lines about it. Or you can also talk of the lumbar puncture, lumbar spine puncture, which we take the CSF out from this lumbar system. No, because here what will happen is in this area we have mainly the CSF over here in the subarachnoid space, CSF over here. Pardon for my pen is sometimes it goes here and there, but understand. So applied aspect, lumbar puncture or chord equina syndrome, you can write over here. Be precise. It is a 3 marks question. Max to max 5 minutes, you are done. Making diagram, 45 seconds to 1 minute. Again, you have 3-4 minutes. Okay, write about the diagram and a couple of applied. The job done. Simple as that. This is how we can easily answer question like what I'm just giving you. I guess you will have a good idea by just listening to each and every topic, and because this will cover the entire type of question that will come. Second, we have medial geniculate body. What you will write in 3 marks. Think about it. We need at least one diagram. Let me tell you. There should be one diagram. So again, middle geniculate body. Remember, M for music, M for middle. So it is a part. Music means ear. It is a part of auditory pathway. You can easily make flowchart of auditory pathway. Easily make a flowchart of auditory 1 or 1.5 marks there only. Then tell about middle geniculate body, where it is located in the diencephalon posterior part. What does it do in the part of auditory pathway over there, right? And a couple of applied, what will happen if the blood supply, if you can remember the blood supply, some cerebral artery is supplying it. Okay, tell about middle geniculate body. Then anatomical basis and effect, lateral metal, this is a big question. Anatomical basis and effects, it is actually, this can be asked as even a 5 number question, but they asked in a 3 number question, fine. Lateral medullary syndrome, if you have time, if you are well versed with the transverse section of the brain stem, then make a TS of medulla. In that show the 9th, 10th, 11th nerves coming from the lateral side, and there you show, okay, this area. Let me just try to show what we can do in this particular question. What are the points we can do in this particular question? The question came as the lateral medullary syndrome, LMS, lateral medullary syndrome, also known as Wallenberg syndrome. If you can make a TS of medulla, nothing like that, 1 number are over here on, 1 number is here, fetched here on. Then in the TSO medulla, the lateral side, make some cross lines. Okay, tell this is the artery, the vertebral artery is supplying over here. And if it is blocked, it will give rise to lateral medullary syndrome. Normally, what are the structures involved? Tell, okay, 9th, 10th, 11th cranial nerves can be involved. So how will the patient present with you? Hoarseness of voice, regurgitation of food. This is how the 9th, 10th, 11th will present. Then say, okay, it is on the lateral side. So we have spinothalamic tract involvement. Okay, so there's pain temperature loss on the opposite side. Okay, sensory nerves are involved. This is how you can explain. Lateral medullary syndrome or Wallenberg syndrome, one of the most common syndromes asked, one of the most common syndromes which happen in case of the brainstem, in case of brainstem, right? This is how we can answer this. So remember, syndrome can come from any part. This is one of the most common. Classify bone according, this is again general anatomy question. Classify bone according to the size and shape with examples. Uh, go to my this section on general anatomy. I will see if we have an image over here. Just a second. Right over here. Okay. See, blood. This all things we have got. See, we have covered the blood supply of long bone, and yeah, this is the classification of bones. In the class also, I told you according to shape you can answer 3 marks question. If you even write say just 3, 4 classification over here, you are done. So typical long bone, short bone, flat bone, irregular bone. It is basic. So how to remember all of this? Think about imagine a skeleton in front of you, like in DH or demo room we have. Think okay, skull is which type of bone, sternum is which type of bone. Okay, humerus is which type of bone, vertebra, which type of bone, can simply answer. Then classification membranous, cartilaginous, ossification, then regional axial appendicular, structure, compact cancers can easily out of 2.5 marks are easily you have in your pocket. Name the parts of midbrain again, make a TS of midbrain. Now this question actually requires you a TS of midbrain, telling you a tectum, tegmentum, and between you have the substantia nigra. A TS of midbrain, a diagram, and you can name the parts. What do they have? Easily 2.5 marks are there for you. The structures passing through foramen ovale. Now, this is now here. It is a tricky why? Because uh, it will be very difficult for you to make a diagram. Obviously, we have to make a middle cane fossa, but okay. For a 3 marks question, you have to do somewhat because you can't just write the 4 structures that pass through foramen ovale, which are the male MALE. MALE. I guess this topic we did yesterday or day before yesterday only about the foramens. Okay. Let me see if we have it over here. Yes. So here you have the foramen ovale, right? These are the obvious 4 structures which are known as the male structures over there. But okay, how can we proceed with this particular question? Let us try. Foramen ovale question is coming of 3 marks. The situation over here is that the foramen ovale, the question is coming of 3 marks. First of all, straight away answer, okay, that foramen ovale, you should know first of all answer. We have the 4 structures, mnemonic is male. But if it is 3 marks, start with foramen ovale found where? It is a oval shaped foramen found in the middle cranial fossa. Okay, between the rotundum and the foramen spinosum. Between the rotundum, I told you, we have the Ross foramen ROS going in posterolateral direction both the side. So with this foramen ovale lying in the middle cranial fossa. If you want to tell the bone, tell it is found in the sphenoid bone. It is found in the sphenoid bone. Okay. Then the structures passed through the foramen ovale are MALE, so mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and you have the emissary vein. These are the 4 structures that pass through the foramen ovale. But this is 3 marks question. You might get 1.5 or 2 marks easily, but if you have time and you are saying, okay, sir, still I think I can write something more, then please go ahead. How you can create some more substance from here. Say mandibular nerve as it comes out of the foramen ovale. Okay, it encounters your otic ganglia below the foramen ovale, and then mandibular nerve divides into anterior posterior divisions. Okay, you don't have to describe the whole mandibular nerve. X-ray meningeal artery, say it is a branch of which artery? It is a branch of maxillary artery. It comes through the foramen ovale and supply the meninges. Its name is accessory meningeal artery. Similarly, go with the lesser petrosal nerve. It is a branch of 9th cranial nerve, that is a glossopharyngeal nerve. Okay. And what does it do? It goes and gives supply to the parotid gland. Okay. Emissary veins, say 1 or 2 lines for emissary vein. No one is going to say, okay, what rubbish or writing. No, it is all within the limits of the question. It is all within the limits of the question. This is how you have to somehow apply your creative and logical mind to reach out to the questions. Okay, reach out to the questions over here. So enumerate the arteries supplying the spinal cord again. It's the diagram and artery supply. What are the arteries over here? It's supplying the spinal cord. Start from above. Theory I'm telling you. Vertebral artery gives off anterior posterior spinal arteries. Then all those radicular arteries. You have the posterior intercostal arteries, right? You have the lumbar arteries. Okay. Then talk of over here artery of Adamkiewicz. Then tell, okay, why are we studying the arterial supply of spinal cord? What is the use of it? It can get blocked. It can get blocked. And then you have the problems in the spinal cord. So tell, okay, anterior spinal artery is supplying this much of area. It supplies the entire two-thirds of the spinal cord. It is supplying the upper half or upper one-third of the spinal cord, the anterior posterior spinal arteries. Tell they're applied also, guys. This is very important. So in any question of anatomy, try to make diagram obviously. And if you can possibly tell a point of applied anatomy, it creates a very good impression to the examiner who is checking the copy. Then we have a black eye. Now, yesterday only we did a topic on the scalp I describe you in detail about the black eye. Why it occurs, how it occurs, where is the bleeding. So explain the anatomical basis. Okay, I told you aponeurosis and the loose areola coming to the upper eyelid. So this is a bleeding which is deep to the aponeurotic layer. The blood trickles down, reaches around the eyelids. So it doesn't mean that if you look at a black eye patient, the injury is over here all the time. Injury can be anywhere in the scalp. Blood can slowly trickle down in some hours and can come down. This here dangerous area phase also yesterday we covered this area. So in dangerous, again, what diagrams you can easily, you have the whole applied aspect. These are very scoring questions. You have dangerous area of face, tell this upper lip and this nose area. Yesterday, go to the previous video and just have a look at the head and neck, scalp and face. Facial veins, cavernous sinus. So tell about cavernous sinus thrombosis. Make a couple of diagrams. Tell the features of cavernous sinus thrombosis if you can. Nasolacrimal duct. When we discuss start with lacrimal bone, lacrimal sac, NLD going down into inferior meatus. With each blink, the secretion, the tears are going down. Tell them applied aspect. If you put on eye drops in a patient, if the patient is lying down supine, just I'm telling you, you must have experienced yourself. If you're lying down supine and you put a eye drop, and suddenly, as soon as the drop touches your eye, you blink hard, no? Then the drop, the parts of the drop will go through the NLD into your inferior meatus of nose. And as you're lying down, that will directly go to nasopharynx. Taste. Taste. So after you apply the eye drops, within few seconds, you develop some tingy taste over there. That is of the taste of the eye drop. That comes. Okay, so these are the ways we have sort of covered all sort of questions where you have so much to answer, where you don't have so much to answer. But remember, time management is the key. Time management is the key. That is priority number one. Second priority is if the question is not of 1 marks, it is of 2, 3, 4, 5, whatever marks like this, try to make a diagram. Not try, definitely make a diagram. Labeling is more important. And finally, if you have answered, take the last few seconds to name one or two applied. If you keep these things in mind, no one is going to stop you from fetching good marks. I'm not just saying you pass or not. You will definitely pass if you apply some hard work. But with more logic and creative mind, you will definitely have good marks. Finally, your MCQs, again, MCQs, simply you have to simple, I mean, this is the most simple you don't have to draw a diagram over here. But okay, let us discuss MCQ. Which type of joint is the shoulder joint? Ball and socket, synovial variety, right? So we have this synovial joint over here, answer done. Second question, which muscle is primarily responsible for the flexion of the forearm at the elbow? Okay, flexion of the forearm at the elbow. Which muscle? Antearm, biceps, brachialis. So we have both options, biceps also and brachialis also. Which is more? The answer over here will be brachialis. Because biceps also has a function of doing supination. Brachialis comes from the entire anterior surface of the humerus and inserts into the ulna. For flexion of the forearm, brachialis is more important than biceps. Which layer is the middle layer of meninges? You all know DAP, dura, arachnoid, and pia mater. Middle is what? Middle is arachnoid mater. Simple as that. Then your spinal cord typically terminates at which vertebral level in adults? Lower border of L1. So it is L1, L2. Simple question. Then newborns, you can say L3 level. Fourth ventricle is located in which part of the brain? Question came, no, rhomboid fossa also. So it is basically in the cerebellum, in just in front of cerebellum, we have the entire fourth ventricle. Which of the following is not a function of cerebellum? Okay, cerebellum is basically for your balance, your tonicity, your coordination of movement. That is what cerebellum is. And therefore, when there is a cerebellar disorder, the patient loses the balance. Patient starts to fall down. There is problem in your movements. So, which is not a function, coordination of yes, it does it. Regulation of tone, yes, it does it. Balance, yes. So, answer should be option number D. In your initiation is done by the cerebral cortex. Okay. Coordination is done by cerebellum and the basal ganglia. Medulla oblongata is continuous with which part of spinal cord? Okay, medulla cervical spinal cord. So option over is cervical spinal cord, right?
Hello, sir. Hello, sir.
So, hello.
Sir, your screen has stopped sharing, sir.
Okay, but here it is showing you are screen sharing. New share. Let me start again. Is it fine now? Is it sharing now? Okay. So medulla oblongata is continuous with the cervical spinal cord. And your two, three more questions. Which cranial nerve is responsible for the sense of smell? Very basic question. First, that is olfactory nerve. Which nerve innervates the deltoid? You should know. Axillary nerve supplies deltoid and tedious minor axillary nerve over here. Which brain divides the body into anterior posterior parts? A very good question. We have discussed dimensional anatomy also, if I remember correctly. Dividing into anterior and a posterior part. So a section should be going like this, dividing the body into anterior posterior part. Which section is this? This is sagittal. This is transverse. This is coronal section, so coronal plane over here, right? These are the MCQs over here. Okay. So coming back to just revising everything, what we have done in the last 50, 55 odd minutes. First of all, I will say again over here, the basic in your theory exam or any exam is your time management. Initially go fast for the first 2 hours or 2.5 hours so that you have time to breathe in the last half an hour, 30, 40 minutes. Time management is key. And not me try to draw diagrams. Okay, label the input labelings. Try to write a couple of applied aspect. Okay. Try to use different colored pens so that in the end, if even if you have 2 minutes left, no, you can actually highlight the important point which you have made. Simple as that. Last 2 minutes also you can highlight the whole paper, whichever important points you have made. So multicolored pens will help you. If your writing is not very good, write with some spaces in between. Give some spaces in between. As the paper looks very clumsy. I'm telling you from an examiner perspective, it is my pain. Because when I see some copies now, it's like, oh my God, how to just read one page? That becomes very difficult. Then the writing is bad. Sometimes you don't understand what is written. You have to underline, okay, what is this? What is this? Obviously, marks will be cut. So if your writing is not very good, then make some spaces, or if you have time, practice. Writing should again not should be very beautiful, but again, it should be at least be readable. Yes or no? Yes, it is common sense, no? It is should be readable, as how will the examiner check the copy? So that is also one very big issue. Okay, in the end, give some time to revise. Give some time to revise, relax. Simple is that if you prepare well, then at the time of exam, you will be very much relaxed and should score good marks. Okay, this exams and this degree is not there just to score some around becomes very if you're fighting to reach 50%, that is not what the course is made up of. Okay, so read the subject well and should score good marks. Apply these few formulas over here, and that will be good to go. My all the best wishes for you guys. If any queries you have, ask in the comment box. I will be happy to answer you. So that's all on my side. Again, all the best and see you soon. Thank you.